Welcome back, everybody. Our next speaker is Dr. Deane Wolcott, a wonderful friend and colleague who is at Cedars-Sinai. He's the Director of Oncology Supportive Care Services and a practicing psychiatrist as well. His clinical and research interests focus on living with cancer, on psychosocial aspects of cancer, how to cope with cancer, how to cope with treatments, and how to have a good and hopefully happy life despite problems the cancer can bring with it. And I really know of no better person to address you to talk about the subject. Thanks.
Thank you very much. It's a pleasure to be here. I'm honored. I would have to say, listening to the first part of this symposium, this is very high-level medical education, okay? Outstanding physicians who presented from really three major specialties involved with the care of cancer patients, and for me, it's been pretty taxing, but very inspiring to listen to. So I'm glad I've had the opportunity to listen so far. Now we're going to change a little bit and talk about what it's like as a person with cancer, or some of you may be family members, close friends of someone with a neuroendocrine tumor, about kind of how you reach the point where you live your own life as a patient with this disease or with as a caretaker as well as possible given the circumstances. Talk a little bit about some of the special challenges of living with a neuroendocrine tumor as opposed to cancer in general, and then talk a little bit about supportive care services. That's not a term you may have heard before, but it is a term that's being used. And here at Cedars-Sinai, for instance, we've had for many years what we now call oncology supportive care services. And that includes myself as a psychiatrist. I also do pain management. We have a rehabilitation medicine physician who also does pain management. We have nurses, we have dietitians, we have social workers. We have a full-time chaplain who's part of our supportive care services program for the Cancer Center. And so for a long time, we've been committed to the whole person approach and a patient-centered approach to supporting physicians and nurses and all of those who are primarily taking care of cancer patients. So that's what supportive care services is basically about. Almost everything I'm going to say, I think, is pretty common sense. It's not necessarily highly profound, but I just wanted to kind of share with you some of the ways that we think about as mental health care professionals of how to understand what patients are going through and how to help them. And the first slide simply makes the point that we are, as human beings, we live in multiple dimensions of life, and cancer can affect each of those dimensions of life, from the physical and biological with symptoms and all of that's related to the disease and the benefits and the toxicities of treatment, the psychological or dimension of what it's like to experience this, the social dimension, how it impacts one's social world, one's social role functions, work, education, social relationships, so forth, and then the spiritual dimension of life, which we all also live in. These are some of the common symptoms in general in cancer, and I think if we look at how to provide the best care as a care delivery system for patients with neuroendocrine tumors, it's really important to the extent to which these symptoms exist in the life of any patient, that they be very well managed by your care provider system, okay? Fatigue, pain, anxiety, depression, insomnia. And many of you we all can have each of these, whether or not we have a neuroendocrine tumor or not. They're not unique or even necessarily unique to cancer, but I will make a couple of points. Much more so than is commonly realized, fatigue is a very important symptom for most patients with most cancers. There's evidence that patients who at the time of diagnosis, 30 to 50% of cancer patients have significant fatigue. Many patients who have additional fatigue as a result of tumor burden, as a tumor may progress, as a side effect of chemotherapy or other treatments. And if you look at what I think is one of the most common, often disabling symptoms that's underestimated and undertreated in cancer, it's fatigue. So if fatigue is a problem that you're aware of, if you're a patient, it's very important that, again, you look at how this can be best assessed and cared for by your care delivery system. We all know about cancer pain is in fact a common experience, including with patients with neuroendocrine tumors. We support Dr. Wolin and the entire group from our team are very committed to doing all we can to ensure that cancer pain is well managed from the standpoint of use of medications and a wide variety of other approaches that can be helpful in minimizing pain, because pain is also obviously results in depression and anxiety and trouble sleeping. It's a whole mixture of symptoms, and to provide the best quality of life, they each need to be fully assessed and fully managed. So what are the concepts that we use? And I'm sharing perhaps more than I ordinarily would, but I just kind of want to share with you how, as we look at the person in front of us and what they're going through, how do we understand some of the forces that are acting on them that may result in that level of depression or anxiety or whatever. And I think it may be helpful as you think about your own experience, if you're somewhere on that journey, if you think about what kind of resources would be helpful to you, that these are various ways of thinking about the human response that are important. I'm going to go through this fairly rapidly in the interest of time. One is life cycle phase. Many patients that I see, and obviously I see a selected subset, are diagnosed with neuroendocrine tumors at a relatively young age. Many patients, in fact, have had symptoms for a long time before they're diagnosed, ultimately. And many patients live with their neuroendocrine tumor for many years or decades, okay? But where you are in your life course when you're diagnosed with a chronic, potentially life-threatening illness, whether you're 20 or 40 or 60 or 75, has an enormous different impact on your life. So life cycle phase, we think about that. Psychosocial illness phases, just as there are medical phases of illness and medical stages of illness, there are also psychosocial illness phases. And when you're diagnosed, there are certain kinds of stresses and fears and anxieties. Once you complete active treatment, although many patients with endocrine tumors kind of are in continuing treatment of various sources, of various kinds, patients who develop more advanced disease, have a heavier tumor burden, have more symptoms. For those patients who develop advanced disease, these are various illness phases, not only from a medical standpoint, but from a human standpoint, a psychosocial standpoint. And it's very important for us to try to understand and for people to think about the concepts of stress, distress, and crisis. We all experience stress. The diagnosis of a neuroendocrine tumor is inherently a source of stress. That stress may become very significant and acute and severe, really at a level of crisis, hopefully not for very long. Then there's the positive side of the human capacity to respond to stress, of what we call coping and adaptation, how you manage your anxiety or your concern or your financial concerns, what decisions you make about your career or your education or your work life, or a wide variety of other life decisions that you need to make. We call that. Something that we're just really thinking about, but has always been part of the human reality of dealing with serious illness, is what we call post-traumatic resilience and growth. We've heard a lot of the tragedy of post-traumatic stress disorder as we think of our veterans and what they're going through, and it's a very real phenomenon. We also know that patients diagnosed with cancer can find it very traumatic and very stressful. But what we're learning is for the vast majority of patients, they get through this and they show what we call resilience or bounce back. They make decisions about making productive changes in their life. They may do things differently than they would have otherwise, but they go on and grow as human beings. And I've had a lot of patients tell me over the years, if I had to do it again, I would have cancer. Not in a way because I like the idea of having cancer for all of the complexities of that, but it's helped me prioritize and think about what I really value, and it's helped me make decisions about what I really want to do with my life. And in a way, I've made the best possible use of this life situation. Loss and grief. Many of the patients that I see who come to me with the diagnosis or concern of depression are simply grieving over the loss of health, or the loss of a job, or stresses in a relationship. And it's very important for us as mental health professionals to help people grieve and to help them understand that's not the same thing as depression that requires medication, for instance. The whole business of social networks and social support, a very important part of affecting the human experience of cancer, the spiritual and existential dimensions. Family cancer history. We often find patients who had a positive family history of cancer. And what was that family member's experience like? Were they well cared for? Did they do well? Did they have pain that was well managed or not? A wide variety of kind of the experiences within the life of a family that can very much affect what it's like from the standpoint of the person to face that diagnosis or to go through the treatment. Caregiver stress and support. One of the things that we're finding that we didn't used to pay as attention to much is particularly with people with more advanced disease, who have more symptoms, who are less able to be fully independent, that this is a tremendous stress on caregivers, often a spouse, close family member, and we know that there can be tremendous psychological and health consequences for caregivers who are taking care of anybody with serious chronic illness. So really focusing on how we support caregivers is important. And then for those patients who develop very advanced disease, there's the whole business of how we as a healthcare system help care for people at that stage of illness, how well we manage their symptoms, how well we take care of their caregivers, how well we preserve their quality of life, so forth. So a couple key comments, which I really made before. The diagnosis of a neuroendocrine or carcinoid tumor profoundly impacts and stresses every aspect of your life. That's, from what I see, almost universally true of everyone. With excellent comprehensive health care, and you've heard of what many of you knew already, how sophisticated is the care delivery system to provide the best care for patients with neuroendocrine tumors, okay? It's perhaps, as Dr. Kuhn said, it's not as rare as we thought, but still, there are not a lot of places around the country that bring together the physician expertise and the care delivery system to provide the best care. So that's really important. But you have access to the best care. With time itself, individual coping and spiritual care resources, as we've talked about, with social support, it is possible to truly live well with the diagnosis of a neuroendocrine or carcinoid tumor most of the time. Now, there are times, and I certainly see this, when patients are so significantly symptomatic, say with pain or fatigue or other symptoms, that they're certainly not, from their standpoint, living well, okay? But for most patients, most of the time, if all of these factors are going well and they're getting excellent care and their symptoms are being well managed, most patients, most of the time, can in fact live well. And as I look at what our goal is, it's not only to contain a tumor and to contain the carcinoid symptoms and so forth. Our goal is to help people restore the best possible quality of life and to live life most fully. And so that's kind of my major message. Many people are from the neuroendocrine tumor carcinoid world are very involved in events like this, and support groups and education. That's an incredibly important source of support and an important way of helping preserve quality of life. And I would say, in my work with the people that I see, many people are in fact able to rebuild a sense of what their life can be and to reprioritize and to do things that they might not otherwise have done but have always wanted to do, and really can create a life of personal meaning, not only at the leisure, at the level of perhaps taking trips they might not otherwise have taken, but really thinking about their career and their legacy, what contributions they want to make. And again, I've seen many people who use this chronic, potentially life-threatening illness as an opportunity to rebuild a sense of what they want to do and to accomplish and the contributions they want to make, whether it's at the level of family or work or career and so forth. And again, as I see it, that's really kind of one of the key endpoints of what we want to accomplish, is to help people achieve that. You know about the many challenges that are unique or highly specific for patients with neuroendocrine tumors or carcinoid tumors. We've talked about the business of symptoms, and I've seen patients who, for 10 or 15 years they had symptoms and nobody really knew what was going on. I've seen patients who were diagnosed or were told, well, this is really in your head, it's not really a physical problem, or were given the wrong diagnosis and therefore the wrong treatment. It's a big, big challenge with this tumor, early and adequate diagnosis. Some patients obviously have significant ongoing GI carcinoid symptoms, and the business of, for instance, the new clinical trial that Ed mentioned to help further manage GI carcinoid symptoms is a really important potential advance in the care of patients with this disease. There are challenges often in accessing outstanding healthcare teams. We've heard about Stanford and UCLA, and there are other programs around the country, and Cedars. But I recognize many people travel long distances. It's not an easy kind of human challenge often to get access to care in a timely way and to get access to that level of expertise. And then often patients have to live with varying levels of symptoms for many years, often many decades. And that has its own challenges of how you come to terms with knowing you have this disease, but also hopefully have a very long timeline ahead of you, and how you're going to integrate your understanding and your experience of this disease with the broader human challenges and opportunities that you face. We talked about the importance of accessing an expert healthcare system. I would say how important it is that symptoms be well managed. And I would come back to the symptoms that I mentioned before: pain and fatigue, anxiety, depression, and insomnia. And as I see patients with neuroendocrine tumors and carcinoid tumors, and I see patients at the Cancer Center here, and we see patients with a wide variety of tumors and diagnoses at a wide variety of stages of illness, I don't think that it's the pattern of symptoms is highly unique among neuroendocrine tumor patients, other than I would say obviously the GI symptoms of diarrhea and cramping and so forth can really be a very difficult problem for patients. I think fatigue is a little bit more common, and as we've said, fatigue in general in cancer patients is underdiagnosed and undercared for. Fatigue is a really big problem, and obviously pain can be a significant problem, and we see patients in which we really have to work with Dr. Woolen and colleagues to make sure that we help manage the pain very well. So getting your symptoms really well managed, and there are others, but those key 5 is very important. And then receiving comprehensive survivorship care. When I was young, cancer was always essentially associated in the public consciousness as being an acutely life-threatening illness. There have been tremendous changes in the last 30 or 40 years in our understanding of cancer and our treatments, in the percentage of people who become long-term disease-free survivors. There have been enormous advances, but we're just now in the last, say, 10 years beginning to think, well, now how do we help people live with cancer now that it's a chronic disease, not an acutely life-threatening disease? So the whole idea of cancer survivorship, of how we help people who may or may not still be in active treatment but have a low level of disease and are going on with their life, how do we help them manage their symptoms? How do we prevent toxicities or minimize the toxicities of treatments that they have had? How do we help them with things like exercise and physical conditioning and diet and all the other aspects of helping rebuild a life that not only is healthy, but in many cases, in many cancers, may minimize the risk of recurrent disease. So comprehensive survivorship care is really one of the most important challenges that we face in our healthcare delivery system. Cedars, we're working on it, many places are. It's becoming an important priority. And the Commission on Cancer has established a standard for all hospital cancer programs as of January 2015, that all patients at the end of treatment are to receive a so-called active treatment summary and a cancer survivorship care plan. What they're saying is that we as a healthcare system, at the right time, should be telling people, this is what your diagnosis is, this is what you've been through, this is the treatment you've received. Now, this is the best way for you to receive care at every level, medically and rehabilitation and so forth, as you go forward. And this represents a sea change in our thinking about our responsibilities as a healthcare system to our patients. I don't think I'm going to talk about that because we really already have, and in the interest of time, this is my, just a couple last slides. This is my list of the services that are really required for cancer to truly provide comprehensive patient-centered care. Now, for each one of these domains, there are national quality of care standards, okay? And as you can see, there's a lot of them, okay? There probably might be some that you can think of services that you wish that were provided that aren't on this list. But this simply makes the point that if we're really going to do it right in caring for patients with neuroendocrine tumors, we really need a comprehensive supportive care services team that has a wide variety of disciplines and expertise and integrated services delivery system. And this really reemphasizes the importance of this part of the multidisciplinary team model that you've heard about earlier. This last slide is from the Institute of Medicine. The Institute of Medicine has, over the last 10 or 12 years, presented a number of very important reports about cancer care. And this is the most recent one from about last October, about how we provide high-quality cancer care in the U.S. population. And I want to just point out, kind of in the blue, the area here in the large arrow. These are what they think are key standards of care that should be met for the care of each cancer patient. Care planning, meaning you really need to know and understand your disease, what is the medical treatment plan, so forth and so on. Palliative care. Now, palliative care is often misunderstood by people as meaning kind of end-of-life care. Palliative care is really simply a focus on quality of life and symptom management and caregiver support and patient education. And palliative care, because it's so commonly misunderstood, is being renamed appropriately. And at Cedars, for instance, our old palliative care service is now supportive care medicine, because we want people to understand that we're really focusing on quality of life and symptom management and so forth, not simply using this as a euphemism for people at the end of life. Very important, and the Institute of Medicine makes that point. From the time of diagnosis forward, people should have attention paid to their symptoms and quality of life and so forth. Psychosocial support, the human aspects of support, as we've talked about. Prevention and management of long-term and late effects. That's their way of saying cancer survivorship services. How do we really help people live well over long periods of time once they've completed initial treatment? And family caregiver support. So these are, I think, as articulated by the Institute of Medicine, key aspects of the human care that people should receive. All right, so we're through with this, and we'll go on. And we'll